the same way I would ask my physicians when I'm out in a clinical setting. I found, I did an assessment, and here are the things, I've reviewed the records. Can you comment on future surgeries, on treatments, on the current medications, future medications, psychological needs, things like that. A third way, which is a way that a lot of my attorneys work with me, is they have reports written by the treating providers. They're not extensive. They're maybe 1 or 2 pages, and they talk about what their thought process is about the future for this individual. And it's been really helpful to me because I take their reports, and then it may just involve a phone call, scheduling some time with this treating provider, and saying, hey, I read your report, I had some questions, and we seem to work together really well. I don't know if that's something everybody does. I'm just going on my experience. It seems that many of the attorneys that I work with do that, and I really love it because it kind of gives me a little insight into what the treating provider might be thinking. I also use the expert reports like that too sometimes in cases where, due to financial reasons or other various reasons, we don't have a recently active treating provider. Another way is I've also asked is to go out as part of that assessment is to find a provider who we can have assess this client who hasn't been recently treated, in order to have that collaboration and someone to say, here's my assessment on records and in person, what do you think? And on the defense end, I would probably do that with the experts that were, the physician experts were on that side. So my